Okay, so let's go to the topic. Patient satisfaction is very important and can always be used as an indicator for measuring and perceived quality of the surgery outcome. Whenever a positive outcome is achieved along with patient satisfaction, this brings great reward for our work. Emotionally trapped in the male body, so patient will seek a way to physically achieve female gender through sex reassignment surgery, or newly termed gender confirmation surgery. I have performed this kind of surgery for over 20 years, and I learned and experienced a lot of good things. Certain patients come with variation of emotionally stressed conditions. So I try my best to understand all conditions and concerns of them and make them at ease and make them happy. We emotionally bond with our patients and do our best to provide aftercare one by one and make them comfortable as possible. So we have been rewarded with very positive response. Additionally, it's about the difficulty of work, which vary amongst the skin conditions in both quality and quantity. Some cases may be pretty easy, and some cases very, very difficult or complicated. But I'm very pleased to help all of them. I devote a lot of time and my best effort in every detail and step of the surgery for giving the best possible result. I make my best effort to establish good and clear communication between surgeon and patient, especially during consultation. Discuss patient about the detail of the technique and of course the limitation of the surgery to prevent unrealistic expectation. So now we go into detail of the surgery. I think for the concept, the abstract that I show in this slide, the audience should read in advance. So I think I'm going to skip it for save time. But for the next slide, I can show you like the summary, in my opinion. I count all three elements is the same important to serve patient satisfaction. That means the surgeon must provide good sensation, natural look of the vulva, and of course a good depth. If you can do all of three elements to be perfect, that will definitely satisfies the patient need. Okay, so to make it easy, I try to make you go step by step with the structure that pretty easy to understand, because we will show what patient expectation, and that is my personal suggestion how we make them satisfied with the result. All right, so we focus on the first one, that is clitoris. Patient concern very common, all right? So they expect pleasure sensation during clitoral stimulation, and of course the ability to achieve the clitoral orgasm. So number one, we should preserve the amount of gland tissue underneath the clitoris, right? It's not like an iceberg. You shouldn't make something very big clitoris, but you can get sensation by the preservation of the gland tissue. That may be another topic that another speaker can maybe enhance the idea. Second is about the proper width with the neurovascular pedicle. That in the slide. So it's pretty simple. You must preserve the dorsal nerve both sides, right? So I recommend you be careful about the width of the neurovascular bundle, not to be too narrow. And the part of the clitoris should be include the outer bridge. So I'm talking about the corona of the penis to bridge with the pupils that is eventually become the clitoral hood, so that it enhances the sensation, because this area is very, very sensitive. Most patients expect the clitoris to be normal size and shape as comparable to a biological woman. All right, so first, do not design the clitoris to be too large, because an oversized clitoris may not enhance the sensation. Second, design a natural look clitoris with the appropriate anterior projection or protrusion. That means you're gonna to make the concept of 3D shape to make the clitoris look more defined. And third, set the clitoris in the proper position individually. I mean, not too high, not too low, because it's vary among the length of the vulva. So let's go to the clitoral hood. Most patients expect a sensation, I mean the sensate clitoral hood, which either partially or completely cover the clitoris, as in the biological woman. So you should design the clitoral hood to be a construct by using the dorsal part of the pupils attached to the clitoris, and the clitoral hood should be set properly so that it can be retracted to expose the clitoris, like in the cis woman, right? So they can spread to appreciate it naturally. So let's go to the labia minora. That I think this is really, really important. Most patients expect the labia minora to be a sensate vertical skin fold in the middle of the vulva, as comparable to a biological woman. So the pupil skin is the ideal material for labia minora construction, because it is sensate thin skin without fat and commonly pinkish color in non-circumcised. So the pupils and the penile flap will be joined to a form of small lip. Most patients do not like a symmetrical labia minora that protrude beyond labia majora. So a design for achieve a symmetrical and small labia minora is highly recommended. That means, with my experience, you have no need to intend to make the labia minora to be too big or too redundancy, because most patients don't like it. Some patients expect the labia minora to extend all the way down to the bottom of the vaginal opening. That they're going to mention you about the posterior fourchette. That is maybe more and more inquiry. So, in non-penile circumcised cases, it may be possible to achieve that request because it can possibly extend the labia minora to reach the vaginal opening. However, if the pupil skin may be not long enough, I think it's acceptable to extend down to maybe just 3/4 or maybe just a halfway. I think this is still acceptable result.